Healthcare is an industry that impacts every part of our life from the moment we're born to the moment we die. Being such an important part of our lives, it's amazing that access to real healthcare, preventative care, the control over our own health and wellness is in reality a scarcity. We go to the doctor when we're sick with a common cold, the flu, an illness, a disease, or an injury. No one really wants to go to the doctor. No one wants to be sick. No one wants to be ill or in recovery from an injury, but we will all be there at some point of our lives and probably multiple times. Take a moment to think about this. Where are all your medical and health records kept? Can you access all of your records right now? The answer is no, or very limited. We have no real control over our own personal medical records. Think about the last time you went to the doctor. What did it take for you to get your medical records to them? Good luck trying to get it, especially if you need your records right now. This is Jeff with the HODL Report. Join me as we explore healthcare on the blockchain. Just a quick disclaimer, any information that I provide is my own opinion. I'm not providing you with any financial advice, but if I am to give you any advice, then let it be this. Do your own research. Invest only in what you can afford to lose. Invest only in what you feel comfortable investing in. And don't buy or sell based on FUD or FOMO that's spread online. So with that, let's get back to our topic on healthcare. So Americans spend over $60 billion annually trying to lose weight. We spend more than $30 billion on vitamin supplements annually. We spend close to $20 billion on gym memberships and more than $30 billion on fitness equipment that we bring into the house. Needless to say, Americans as a general rule are looking to get fit and find a way to fix their lives for the better, prevent illness, disease, essentially live better. With this mindset, Americans actually spend around $150 billion per year trying to get fit or stay fit. This is what we can call healthy care. On the other side, we have sick care. Heart disease alone costs over $300 billion per year in the U.S. Health care or sick care costs on obesity are close to $200 billion per year. Childhood obesity costs around $14 billion per year. Sick care costs from cancer are around $80 billion per year. So heart disease, obesity, cancer have a direct impact of more than $600 billion per year in the U.S. In the U.S., we spend over $300 billion on pharmaceuticals each year. The U.S. government actually spends over $1 trillion per year on healthcare expenditures. Total healthcare expenditures in the U.S. actually exceed $3 trillion per year. Now, globally, global healthcare expenditures will exceed actually $10 trillion this year, with some reports showing that over the next 15 to 20 years, that cost will go up to $18 trillion per year on healthcare. Now imagine how many parts of this healthcare system in the US and globally are simply broken. There's no standardization of healthcare records. Those electronic records that do exist don't communicate with each other. People actually have absolutely no control over their own information. There's simply no way to have direct access to all of your medical information with the current electronic medical system. If you ever have had an ultrasound, a CT, an MRI, an EKG, or any other medical device test, those records and images are typically stored at the testing location or on a local cloud server, and access to that information is actually limited to that specific provider. Even you as the patient will have limited or absolutely no access to the information unless requested from that provider, which is many times difficult to get. You as the patient and owner of that personal medical information really have no control over how or when those studies can be sent without begging the location to send them, and that is just not an easy task. Insurance companies, government-controlled insurance around the world have begun to dictate who, when, where, and how you're seen by a medical specialist. This happens in the U.S., but not as much as it does in other parts of the world. Think about this. Your personal data, allergy information, history of illness, history of injury, even something as simple as your blood type isn't accessible to you right now. This information is normally stored in some of the centers in their locally controlled databases, as I had mentioned, or in some online medical data storage. Even within the large hospital-owned networks, there's a limitation to which patient information is available at which location. So if you go into location B and you normally go to location A, there's a good chance they won't have your medical information. If you go to Dr. Smith, but you need to go see Dr. Joe for something else, they don't communicate with each other. They don't have access to your health medical records. They don't know what's going on with you. And so you have to tell them exactly what's happening, but you might not understand the medical condition. They just have no access. Just trying to switch doctors. Does your data follow you? No. Do you ever request to transfer it? Yes. Does this consume a ridiculous amount of time? Yes. Is the information always complete? No. You're relying on the individuals that are properly filling it in. Even if you're visiting a specialist, it's up to the patient to make sure that your records arrive. How many times have you filled out your personal information before seeing a doctor, and why does every single doctor need this information? When traveling domestically or overseas, absolutely none of our information follows us. Imagine getting sick or injured while traveling. How do you easily transfer your own medical data quickly? You simply can't do it. We can't do it at home. How are we going to do it when we're traveling out of our own state or even out of the country? It can't happen. Now, we've identified that as patients, we have absolutely no control over our own personal medical information records. Transferring this information between doctors is extremely difficult with the current system. Gaining immediate access to critical health information simply isn't possible. Each time you go to a new doctor or a new medical center, you have to fill out and give all of your personal information all over again. There's really no way for doctors currently to collaborate on your health without relying on you providing all of the data, and they don't get complete data. Each doctor, hospital, and imaging center has its own silo of information, and there's absolutely zero communication between them. Your data is theirs. Your data is not yours to easily access. It really isn't yours because they're controlling it, and there's no collaboration between your healthcare practitioners and providers. The system is simply broken. There has to be a better way. Can it be fixed with blockchain technology? Can there be a healthcare token or coin that actually pays the patient to be healthy and pays the doctor when we're sick or we seek out their care? Let's imagine together a healthcare system in which you have complete control over all of your patient records. You can take this information with you wherever you go, domestically or internationally, and you have direct access to it whenever you want. You have direct access to physicians anywhere in the world. You can consult with these physicians, any specialist, anywhere in the world on a secure network and video conference format from the convenience of your home or wherever you're traveling from on your mobile phone. Payments for your medical services can be made electronically, cross-border, without worry of exchange rates or cost of exchange. Physicians can readily treat you and consult you without any concern. Your data then is your data, and it's extremely, extremely valuable to the many companies that are involved in this multi-trillion-dollar industry. Think about the pharmaceutical companies, the nutrition companies, and all the other companies that are involved in this healthy care or this sick care that are making money from us right now, and we're earning zero from it. Imagine a world in which you profit from your own demographic data being shared. You profit when a pharmaceutical company or a nutrition company or a fitness company sends you an ad or asks you to engage in their product. Imagine if you're able to profit by taking care of your health, from exercising in a gym, reducing your weight, your waistline, keeping your health stats at peak normal levels. Imagine a way in which you can make money from this multi-trillion-dollar profit machine by staying healthy and out of the boondoggle that is the sick care industry, while spending more time in the healthcare, working out, eating well, staying healthy, staying fit. There are actually two competing forces here. We have the healthcare industry on one side, promoting to keep you healthy, and then we have the sick care industry on the other, which is there to really put band-aids on illness and save you when you're injured. Through the blockchain, we can secure our healthcare data, we can share our healthcare data, we can pay our doctors, consult with our doctors, benefit from staying healthy, receive compensation when our demographics are shared. Healthcare providers, in turn, can quickly and easily get paid. To me, this is a win-win when we put healthcare onto the blockchain. Cost of insurance can be reduced significantly due to the huge amounts of wasted overhead in manpower and erroneously tracking the poorly managed patient information and records database. Just overall, we can see a complete reduction in costs. There's way too much manpower involved in the insurance, in the payment structure, in the physician offices, in the management of payments. There's too much wasted money, and as a result, our healthcare costs are ridiculously priced. And actually, in the U.S., we have the highest healthcare costs in the world. We have the highest pharmaceutical costs in the world, and obviously there's more to it than just wasted manpower. There's also the legal side of it, and a lot of these things can actually be resolved if we're able to properly document and manage our own healthcare information via a ledger-type protocol. Now, the competing retail of pharmaceuticals, nutrition, clothing lines, they can compete for marketing and advertising space to actually cover the cost to pay for the doctors that are providing their healthy care and sick care services. Maybe not all the costs, but it can stipend some of the costs. It will reduce the costs. Just like a professional athlete is getting compensated, why shouldn't a provider be compensated if they are advertising and marketing pharmaceuticals? Right now, it's illegal for them to do that because it's a form of payment. But as a patient, as a practitioner, shouldn't everything be open and more transparent? Because in reality, are these pharmaceutical industry companies not really providing some form of compensation through free samples and lunches and the big show and all the money that they put into the marketing aspect on TV? They're bombarding us on a continuous basis with their advertising, and we have no control over any of it, and we have no control over our own information. So this is truly a good way that's a win-win to where we now take control over our own data. So somewhere hidden within the blockchain, there is going to be the solution. The system definitely works. The question is, who's going to be the first to uncover it? Which token or coin has the established ecosystem for the needed information database to be built on while incorporating an entire payment structure that handles cross-border payment transactions and even micropayments? I'm sure you all can think of a few coins and tokens that could help. XRP comes to mind, XLM comes to mind, BTC comes to mind, ETH comes to mind. I mean, there's a slew of them. There's only a very few handful that right now today are capable of handling cross-border payment transactions quickly, micropayment transactions that could quickly be incorporated into some form of a shell software that can help really accommodate and accomplish the tasks set at hand. I truly hope you enjoyed today's topic. If yes, please remember to give a thumbs up and subscribe. In future cryptocurrency real-world use case videos, I will explore this healthcare industry. I'm super passionate about the healthcare industry. There is a lot of change going on right now within healthcare, especially within imaging, especially within data access, and especially within data storage, patient data storage, information storage. There is so much going on right now that's growing within the healthcare industry in the blockchain. In some of these future videos, I'm going to highlight some of the existing companies in this space. I really want to focus in on patient records, on the data storage, on research, on monetary gains, on patient care, how patients and practitioners can both gain financially through micropayment structures and the opening up of your data and sharing it with the companies that will be marketing to you, so there's a form of compensation coming back. I look forward to seeing you on my next video, and in the meantime, keep on hodling your crypto.